Suture is a stitch or series of stitches made to secure opposition of edges of a surgical or traumatic wound. Absorbable sutures are degraded by hydrolytic enzymes of the body, while non-absorbables do not. In absorbable, we have vicryl, monocryl, catgut, while in non-absorbable sutures, we have silk, cotton, linen, nylon, and polypropylene. Let's discuss them one by one. Polypropylene is basically a synthetic, non-absorbable and monofilament suture, widely used for skin closure in general surgery, plastic surgery, and cardiovascular surgery as well. The advantage of proline is that it won't lose tensile strength over the time, not security, very little tissue reaction, and high plasticity. Its disadvantage is that it's stretch when pulled and it loosens when edema subsides. As you can see, ये हमारे पास proline 20 है and it's blue in color. It comes in various sizes. Then we have silk. Silk is natural non-absorbable monofilament suture. Is used in ophthalmic surgery, general surgery, and plastic surgery. Advantages are ease of handling, not security, and cost effective. Its disadvantage is that it's very reactive and cannot be used in area of infection. And ये हमारे पास silk 20 है and it's black in color. At last we have vicryl. Vicryl is a synthetic absorbable suture. It's widely used in intraoral suturing, gut anastomosis, vascular ligature, and ophthalmic surgery. Its advantage is that there is minimal tissue reactivity and it can be used in infected tissues as well. Disadvantage is that in case of prolonged approximation, it cannot be used. There is delayed absorption and increased inflammation. And as you can see, it's purplish in color. For easy identification in exam, आप इनके colors याद रख सकते हैं. Like proline जो है वो blue color का होता है and it's like a wire. फिर हमारे पास जो सिल्क होता है ये बिल्कुल धागे की तरह होता है और ये ब्लैक इन कलर होता है. और हमारे पास जो वाइक्रल है वो पर्पल कलर का होता है और ये भी धागे की तरह ही होता है, अनलाइक प्रोलीन.